Thanks so much for being here, Kevin. So as you know, you're joining me here today to talk about your experience having had a traumatic brain injury, all of the work that you're doing now with advocacy. And then I've got questions from my class who are in their second year of their master's program, so about to be finished to become speech pathologists and to serve people like you and others who have had brain injuries as an example. And so they've got some specific questions that I'll ask you, but first I'm hoping to just have you kind of share your general experience with us and kind of give us the lay of the land before we dive into some of the more detailed discussion.
Awesome. Awesome. Yeah, it's a pleasure to be here. I remember, speaking for your class in person,
Mhm.
last year, 2 years ago.
I think it's about 2 years ago now.
Yeah. Okay.
Yeah.
Yeah. So my name's Gavin Ballister. I wrote a book called How to Feed a Brain. I don't have a copy with me right now, but yeah. So I'm a severe traumatic brain injury survivor, and I'd like to share my screen and kind of give you a little presentation about how my story starts. So let me see if I can do that here.
Sure.
Um, all right. So what I would do is share screen. Okay. I think this will work. Okay. And then where's the play button? Here it is. Okay. All right. So the brain. This is what's controlling everything, right? And the brain is so intricately complex with 86 billion neurons making trillions of connections all over. And actually what you're looking at here is actually my brain. I had my brain scanned with high definition fiber tracking back in 2017. And this like outlines the groupings of neurons and axon fibers. And I'll show you a little something here. Let me see if I can pause it at just the right spot. So here we go. This is the brain right here, right down the middle of this. This is called the Central Fissure. And what we see here is two hemispheres, and they should look pretty similar. I mean, clearly there are going to be differences, but as far as looking at this, they should look pretty similar. Some things to note about my brain is, first of all, the left cerebellum over here, and the cerebellum is super important, and that controls that. It basically takes input from all of our peripheral nervous system and our autonomic nervous system, and it coordinates muscles to send the information that's important to the cortex, which then sends it down to do something. This includes swallowing, this includes talking, all of it, it includes walking, moving your hand, all the things we do. So you can see my left cerebellum is frayed. It's definitely different than the right cerebellum here, and that shows up in my function. So neurological tests, you do this as quick as you can. This is as quick as I can do it on my left hand, and maybe I should show that.
Well,
Maybe
I
we
can
should.
see it. I can see it up in the corner. I think we
You
can
can see it
we
in
can
the
view.
corner. All right,
Mhm.
cool. And then you can also see in the right occipital lobe, there seems to be some matter missing, some connections missing. And that's the occipital lobe that has to do with vision. And we can talk about that later. Well, we don't need to talk about that. We're talking about speech and swallow
We're
mainly. So
we're
stick
also
with that.
interested in hearing about any changes that you noticed following your brain injury. Absolutely.
How much time you got? All right. So here's a bit about my story. So in 2011, this was me. I sustained a severe traumatic brain injury. I was insulin conscious, rushed to the hospital, put on life support. While I was in a coma, my mother came and visited me, and the doctor came in and gave the list of injuries that I'd sustained, And those injuries include a bruised and swollen left eye, fractured right ilium, a fractured right sacrum, 3 cracked ribs on my left side, a nasal fracture, a lacerated left kidney. Both of my lungs were severely bruised. I also contracted infections, MRSA and pneumonia, which are both life-threatening. And then they scanned my brain as well. Bruised left frontal cortex, bruised left temporal lobe, and subdural hematoma. And later found out, I'm not sure if it's going to be on this slide, but yeah, I also sustained a severe diffuse axonal injury. So I was comatose for 12 days, and then I woke up. And I woke up and I looked awesome, as you can see. And you know, several months, whoops, let's go through this again. There it was. And I'm going to show you some pictures of me in the hospital. This is going through. First of all, you can see I'm closing my left or my right eye. And it doesn't matter which eye I was closing. The thing is, I have double vision. So it's called diplopia. And basically when we look at something, we see 2 images, one with each eye, and our brain goes, okay, these are the same image, and puts them together. My brain doesn't do that as well. So the image I see with my right eye is lower than the image I see with my left. But of course, that was the least of my problems at that point. So so going through recovery, we are in physical therapy. I was in a wheelchair, but for my eye, I wore an eye patch, which makes a big deal. I switched it every like 20 minutes. I would switch it from side to side so that my eyes were evenly strong, you know, so they both got exercise. You can also see I have a tracheostomy. So I was breathing through to my neck. And you are likely working with valves and things to actually speak at that point. The thing is, I couldn't even. I had a occluded trachea, so
Okay.
so 2.5 centimeters of my trachea were narrowed down to the size of a drinking straw.
Oh,
So
wow.
even when I tried to like plug it and force air through my pharynx, um, I wouldn't, it wouldn't work, you know. And I could do it, but my face would turn bright red, and it wasn't happening. So what I learned to do was mouth my words, was really articulate with my mouth in order so that people could read my lips.
Mm.
And that's really powerful thing to do. So if you have patients who are unable to speak, and are unable to, you know, use a valve that allows them to speak, getting them to fully exaggerate their speech so that they're talking in a way where you can see it clearly, that's very, very useful. I found that to be very useful. And I also want to say that I also work with clients who are recovering from a brain injury. I work as a neurotrauma medical advocate, which is where I work with people who have a loved one who sustained a brain injury and they're in a hospital setting, or they require nursing assistance daily. And what that's the neurotrauma side, and I help them navigate through the medical, you know, matrix, as I call it, and get the treatments that are going to help them the most, even within our current medical model, and navigating through that. The other thing, and getting even when they're not the standard of care, you know, because the
Right.
standard of care, it's really good in one aspect, in that it ensures a certain level of care, but it's also very limiting for doctors and therapists because they can't, and just medical professionals, because practicing outside of the standard of care makes you liable to be sued for malpractice. So I working with clients, there are ways around that. And with working with practitioners, there are also ways around that by getting the okay from the patients. And I can talk more about that if you're interested. But when it comes to empowered neurorehabilitation, that's when I work with clients in order to get them to recover as best they can. So I work with clients all over the world. I have a client in India I was working with
Mhm.
last night, their morning, um, and we were working on some speech things, um, things like tongue twisters and enunciating effectively, and I can talk more about that as well. But anyways, there I am with an eye patch and a tracheostomy. Hold on one moment.
Sure, sure.
Come here, puppy. Come here. Good girl. Come here.
And so let me ask you, at this stage, when you were articulating and having people who were interact with you lip read, was there a possibility at that time for you to write as well your message?
Yes,
Did you use that
very
as a
lucky to be
strategy?
able. Yes,
Okay.
yes. And I work with clients who are not able to write,
Mhm.
um, or where it's very difficult, where like writing a sentence takes 2 minutes, and luckily it was my left hand that was is mostly affected by my cerebellum being damaged.
Mhm.
But and I'm right-handed, so I still had that.
You still have
I'm
that. Okay.
I'm working with a client right now who has a very similar thing going on, but it's his right side that's ataxic,
I see.
and his writing is very, it's very difficult when you're not getting the information to your cerebellum to coordinate the muscle out. Um, so yeah, that's at this point. Writing is huge if you can do it.
Mhm.
Awesome. Um, let's keep going through this. I also had a peg tube. At one point, I had a nasogastric tube for a while, and that's pretty annoying to have a tube out of your nose. So it's a great temporary thing, and it's interesting. My mom was so like don't give him a peg tube, don't do a surgery to put it in. It's really not that big a deal getting a peg tube. It's pretty, it is invasive, but it's pretty, pretty standard. They can just poke a hole in there, put a tube in, and it makes things so much easier. Working with clients, I find I love it when they have a peg tube for several reasons. I also do a lot with nutrition.
Mhm.
Right, my book's called How to Feed a Brain, because nutrition played a huge part in my recovery, and getting nutrients into people is a lot easier when we can bypass the
Right.
swallowing mechanism.
Sure.
Um, so yeah. That being said, food is so important.
Yeah.
Eating is so important. I didn't eat, walk, or talk for months. Eat conventionally, that is. Um, and I wrote this in my blog, but primal instincts override rationality at that point. And like I would have traded being able to eat for being able to walk. If I could have a delicious meal, but I'd never be able to walk again, I totally would have taken it. I'm glad I didn't. I'm glad
Right. Right.
it just now I got it all. But yeah, I mean, it's so important. And I actually want to tell a quick story about when I was going when an experience with a speech language pathologist that was not favorable. It was a
Yes,
beginning.
and so I'll say that one of the questions that came up from many
Yeah,
of the students includes wanting to know kind of throughout your recovery, so right afterwards, all the way through, what were the things that were really great that speech pathologists did, and what were the things that they didn't do so well? Like, what are things that you would advise us against doing?
perfect. Yeah, one thing that speech pathologists do very well is um, is I guess a lot of it being almost cognitive, like the cognitive rehab stuff.
Sure.
Um, I really appreciated so much of that, and I actually stayed with with her name's Catherine Hayes. She's in where is it, Dripping Springs,
Okay.
and she's fantastic. And I had my speech back, and I was pretty happy with it. I mean, still very much mistaken for being drunk a lot of the times, um but she was just great, and we were working on getting my speaking really solid, because for my speaking career, for
Right.
my presentations and actually being on stage and speaking effectively. So that's something that I continued to do for several years, when I was up and walking, talking out of the hospital, and
Right.
giving presentations on stage, because I found so much value in that.
Right.
Um, One of the things that is pretty upsetting is, the speech language pathologists hold the keys to whether I could eat again, and as I said, being able to eat conventionally is so important. I mean, eating is so natural for humans. We do it socially. Food's a big deal.
Right.
At least it is to me,
I
and
completely agree.
yeah, and when you're not able to eat, it's like it's maddening. I'll tell a little secret that I haven't really put out there too much, but I used to sneak an extra bottle of Boost, which is like the terrible liquid formula that they fed me through
Oh,
the
okay.
peg tube. But I'd actually sneak that, and I'd hide it under my bed while I was in the hospital, because it wasn't enough nutrients. And I would practice swallowing with that, and my speech language pathologist would like her hair would fall out if she heard about this. But yeah, I was practicing a little bit, and there was a time when, and she explained the risks of, like, if I aspirate that and I get sugar in my lungs, um, it's not good. Is that
Right.
there's risk of infection, of pneumonia. It could be life threatening.
Right.
So but he was like, having something in my mouth, like eating something, was so important. And I did have a speech pathologist who allowed me to do trials with ice chips
Okay.
to try to do that, because if I aspirated ice chips, it wasn't the end of the world. It was water. It was like, but I started it. Um, they call it silent aspiration,
Mhm.
where I wouldn't cough,
Right.
even though I was aspirating, and and that made it really dangerous to do any of it. At least that's what they said. They were like, no, no ice chips for you, and that might have been why I smuggled, you know, an extra boost. Um, yeah. So the other thing is, when I could eat, so at one point I went to see. I had a throat surgery done, which resectioned my trachea.
Okay.
Essentially, the occluded section, they sawed on either side of that occluded section, pulled that out, sewed the two ends back together, and now I could breathe through a trachea that wasn't swollen up.
Right.
And I was able to talk at that point. And then but I still wasn't able to eat. And so I scheduled a meeting with Tamar Kotz, who is the speech and swallow doctor at Mount Sinai, and went and saw her. And she was just about to leave for vacation. And she said, and it's so funny because I was just writing about this, like it was like 9 years ago last month or whatever. And I'm doing anniversary posts where I write about what
Oh,
happened,
great.
9 years ago.
Great.
And so, yeah, and so you can see those on Adventures in Brain Injury, or you can see those on my Adventures in Brain Injury page, my Facebook page, Feed a Brain page. It's not always on Feed a Brain, but I always post them on Adventures in Brain Injury.
Okay, great.
Yeah. So Tamar Kotz, I contacted her, and she was like, I don't know why you're coming to see me, but Brett Miles, who was the surgeon who resectioned my trachea, asked me to see you, and he's like, I'll do anything for him, and I will too. He's slit my throat to save my life. So so I went in and I'm like, I gotta eat something, like I think I can swallow. She's like, well, I'm not set up to do a whole like barium swallow test with you right now, but what I can do is I can feel your pharynx. Yeah, I think I said larynx or pharynx before, and I meant larynx.
That's okay.
um
Okay, yeah.
yeah. So yeah, she's like, I can feel your pharynx and see if you're swallowing appropriately based on feel, but it's not like I can't sign off. And I'm like, all right. So we did that, and she's like, you know what? Yeah, I think you can do trials, and eat something for was it quality of life or something like that was what she said. And that was great. So I would eat something, and then I would get the rest fed through the peg tube, which is great. And I use that with my clients also. It's like, you're not really at a point where you can get enough nutrition
Sure.
eating orally. So it's nice, and it's nice to have a peg tube instead of a nasogastric tube, because that
Right.
thing's annoying. Um, and yeah, so she was great. And then after that, I had a visiting nurse come, and she was like, nope, you can't have anything. And I was like, Tamar Kotz said I could. And she's like, it doesn't, Brett Miles said you couldn't. And there was this whole like
I see.
back and forth. And that's something that was, and she was new, and I contacted Tamar later, and we figured it out. But Tamar was like, yeah, a lot of the times new SLPs are very nervous to allow anything, because of liability, and like
Sure, sure.
um and that makes sense. But it's also, there's a therapeutic zone, and there's we call it eustress and distress. Distress is when you practice something, but you go beyond your therapeutic threshold. So it's like lifting weights. Like if you try to lift an inappropriate amount of weights, you're gonna like drop the barbell on you, and it's
Sure,
gonna
sure,
crush
sure.
your chest, right? So, but if you're lifting an appropriate amount, you get stronger because of it.
Mhm.
So as far as swallowing, same thing. We want to practice swallowing safely, and that's where so this this speech pathologist, I forget her name, we'll call her Mindy, but she was like, it started with an M, but it doesn't matter. But she was very much like, I'm here to give you the rules. and not to help you swallow really.
Not to
She
really talk
focused
to you and get your buy-in and that sort of a thing as well.
right.
Yeah.
Yeah. So yeah, I didn't like her.
Okay.
And I did make a video for SLPs that I
I
don't
saw
know if you
that.
have.
I saw that.
Yeah,
Yes. Hmm.
great. Yeah. Happy to share that with you guys as well.
Yes. Thank
It's on
you.
YouTube. You can watch it anytime anyways.
Mm.
It's on the Adventures in Brain Injury YouTube channel. And so yeah, I didn't like her because she was so like scared to do anything to progress me, and therefore it was holding me back. So there's a balance, right? You
Hmm.
don't want things to be dangerous, and you don't want to be tiptoeing too much and not progressing your patients.
Sure. Sure. That's really
Yeah.
great advice. And when you were in the hospital, above and beyond the swallowing component, was a speech pathologist working with you in any other kind of manner, or was it only restricted to the swallowing?
Let me think. I think at first it wasn't speech, so it was swallowing. Yeah.
Hmm. Okay.
Um First we weren't doing anything speech wise.
Right.
And later, like basically when I could swallow, and as I was saying, when my speech and swallow doctor said, and I don't know if it's an ear, nose, throat doctor or what. I have to look at notes. But when she said, yeah, you can do some trials, um, and then the visiting nurse, speech language pathologist, was like, no, you can't. That was She was working on vocal stuff, on voice,
I
which
see.
I hadn't had much at. Um, so and all that was on my mind at that point was, I want food,
You want, yeah. Hmm.
and I don't like you. and and sitting across from a speech language pathologist who's not letting you eat and who you don't like.
Exactly.
Um, and they're like, all right, now say this. It's like,
Yep.
yeah,
You're not going to have any buy-in
I
at that
didn't want it.
point.
Yeah.
Right.
Yeah, you're not getting buy-in, and honestly, when you're put in a dependent state like that, you
Right.
revert to dependent tendencies, and you turn into a two-year-old in many ways, you know. So, and it's not anything anything bad or wrong, and especially not something to make fun of or be like, you're being a 2-year-old. It's just
Sure.
like, of course you're being a 2-year-old. You're in a dependent state, but you're gaining your independence, you
Independent.
know?
Right. Right.
And that's something I really saw with brain injury in general, is that, and really, and other debilitating conditions, or injuries, is that it puts you in that dependent state,
Hmm.
and you revert a lot to earlier stages in life. So I've actually um, compared recovering from a brain injury like growing up all over again. Only the difference is I had the frontal lobes to see and to understand what was going on and watch myself learning,
Yeah.
which was a very cool place to be.
I imagine that
So
it could be very interesting, but at the same time, very frustrating.
very frustrating, very right on. Yes, very frustrating. Very frustrating.
And
And having, a speech language pathologist talk to you like a baby,
yeah,
when you have the wherewithal, and having lots of people talk to you like a baby. I mean, it's been that way for quite some time,
wow.
honestly, because after my injury, I ended up, well, yeah, let me fast forward a bit in
Sure,
this
sure.
story, to, well, we'll get there.
Okay.
Do you have any more questions about this stage?
Yeah, so I guess the one other question I had about thinking of thinking about pretty close to following your injury was whether or not you noticed kind of tell me about what other things you noticed in terms of changes. So you noticed obviously the change with vision, swallowing. What about cognitive changes? What were the things that you noticed early on?
Nice. So I didn't notice them at that point, because
Mhm.
your brain is your organ of perception, and my brain was damaged, so I couldn't even see myself not being able to see myself. You know what I mean?
Mhm.
So it's an interesting paradox. And later, you know, as I uncovered what had happened, and going through the medical records and understanding what would happen, and I'm so thankful that there was video, there was text message history, and like all
Right.
of that, so that I could decipher everything that happened and get a picture of what was happening in that time. One thing and the bottom line is I was in a brain fog,
Mhm.
and you can't see you're in a brain fog when you're in a brain fog because you're in a brain fog.
Right. And so and so I know we're going to be moving forward in time to kind of another stage following your injury, but if you had to give a kind of just a rough estimate of when you feel like you had some awareness about kind of the cognitive changes that were present, about how long did that take until you were really able to kind of see that?
So I get this question all the time, and it's not really a time thing.
Hmm.
It's more for me, it was a nutrition thing.
I
For
see.
me, it was when I healed my digestion, I healed my blood-brain barrier, I began getting the nutrients that my brain needed to my brain, and my book goes into that. So Feed a Brain will talk about how that was done, and what regaining clarity, wh- what happens when your brain finally gets the nutrients that it needs. Because when you have a brain injury, your blood brain barrier is breached. It's open, which means any toxins, inflammation, whatever in your body is easily able to cross your blood brain barrier, which inflames the brain, which reduces communication to the digestive system, which means that the digestive system becomes permeable, more permeable than it was, which is also very common with brain injuries, intestinal permeability. So, so, um, so I mean, I know this is a nutrition thing. Should I go into intestinal permeability?
I think why don't we stick with the speech and language and cognition
Cool,
side for now, and then if we have extra
cool,
time, certainly we can delve into that.
right.
And so in terms of kind of timeline, then we're thinking about when you had enough nutrition, you felt like is when you started to have that awareness. About how
Not just
long would
enough, not just enough nutrition, the right kind of
the right
nutrition.
kind? And
Yes, the right kind
and
of nutrition that healed my digestion and that
okay.
healed my barriers.
And how long after your injury do you feel like that kind of stabilized?
So for me, let's see, that was about 1.5 years, and I'm very lucky to have been steered in the direction
I see.
to where I was able to heal my digestion,
Mhm.
because that's not part of the conventional medical model. Um,
Right.
and so getting to a place where we are actually doing things from more of a functional medicine model, and more of a Eastern and Ayurvedic and all sorts of different practices that focus on the digestion, which is where the nutrients that our body assimilates, that's where it starts. That's the majority of the input to our body comes in through our digestive system,
Okay.
and our lungs, but that's gaseous. That's a whole different thing. But like the nutrients that build up our building blocks. I mean, we've all heard you are what you eat,
Mhm.
and that's true-ish. more accurately, you are what your body is able to do with the food you eat.
Mm-hmm.
So if you're not absorbing the nutrients, then it's not it's not building you. And in fact, if you're not absorbing the nutrients, it may be inflaming your body and causing immune response and all sorts of things.
Okay.
So
And so that was,
so yeah.
you felt like that was a bit more stable about a year and a half after your injury. And that is when you noticed that you could really perceive the cognitive changes that had occurred. Okay. That's really
That's
helpful.
when I that's when I started
Really
perceiving, and
helpful.
that's actually when I started writing also,
Okay.
is because I started to regain some clarity. And that's
Hmm.
when I was like, okay, there's something to nutrition. And
Sure.
I wasn't writing a book on nutrition at that point. I was writing about my experience. So
Mhm.
what I did is, on the anniversary of each important event of my brain injury, I began to write about what happened the year prior. Um, and and this was extremely cathartic for me. It helped me to actually, see what the the whole of what had happened during this time that I had very little memory of.
Sure.
And the memories I did have were
Sure.
foggy at best.
Well,
So
that's
and
really
I
helpful.
yeah,
And
yeah.
and so moving then from more of the kind of acute phase when you were in the hospital, let's talk about what your recovery looked like once you were kind of discharged.
All right, let's go forward
Sure.
on this slideshow.
Mm-hmm.
So still in the hospital. Um NG, this is actually before. This is me with an NG tube. But you can see how emaciated I am. I think I showed this to illustrate how emaciated I was on the
Right.
nutrition that they were giving me.
Mm-hmm.
But at one point, I took my first steps, and this was about 5 months after my injury.
Mm-hmm.
And this was a huge deal. This is the first time I had put any weight on, or I'd walked without a walker, in months. And this is how I celebrated the 7-year anniversary of my brain injury.
At Barton Springs.
Got it. You got it. Barton Springs.
Oh,
Yeah.
great.
Yeah. So let's see what do I have next? So a lot went into my recovery, a whole lot.
Mm-hmm.
And at one point I was steered towards a nutritional protocol, and I began to regain clarity, like I was saying. And
Yeah.
I used that regain clarity, and I started to study everything I could. Um, and I started to implement everything I could. And thank I thank the internet so much. Actually, my book, I thank the internet. I also want to give a thank you to the resource that is the internet
Yes.
for providing the ability for me to get the information I needed. I was able to read peer-reviewed research, connect with doctors all over the world,
Mhm.
and it really, really powerful stuff. So let's see. And then this is this yeah, this is important. This is neuronal migration. This is how neurons grow and synapse with each other. So it's showing neurons growing and synapsing with each other. And this is the basis of neurorehabilitation. It requires the supplies. So as I was saying, that was a huge bit. But the other thing is doing practices on my own. Um,
Yeah. And so
so
when you were discharged and were involved with speech and language therapy, what was the focus at that stage? What were you working on?
so all right, you know what? I can get out of here and stop sharing my screen. Yeah. So ask the question again.
Yeah. So when you were discharged and back home and you were receiving speech therapy, what were you working on kind of at that stage?
So at that stage, so I didn't have speech therapy for a little bit,
Okay.
and I was looking up things that I could do. My mom and I were both looking for things I could do, and I remember she came to my room and she had a few like easy sentences for me to read, and I was like, this is dumb, you know. And I actually really music changed my life. Like music, I was a musician before my injury, which which really lent a lot to my recovery, because as a musician you understand the process of learning, and really we all understand the process of learning to a point, right? But there are studies that show musicians' brains being more fibers in the corpus callosum and things of that sort, and it being more networked within. So musicianship is great. And when as I said, my left wrist was totally flexed inward, and I used to play guitar, and I couldn't talk, and I couldn't lift my wrist enough. But as soon as I could, I worked to lift my wrist, and as soon as I could lift it enough to wrap it around a guitar, that's what I did.
Yeah.
And I had the throat surgery, and I could talk. And as soon as I could talk, I tried to sing. And singing is so powerful for our brains, for our hearts, for our, for our pharynx, for our larynx, all of it. It's really powerful. And yeah, for our brain, it stimulates the vagus nerve, which stimulates, which innervates all of our autonomic function. So singing is really powerful. Gargling as well
Mhm.
is a really powerful tool that speech language pathologists can use.
And was singing ever used in speech therapy with you? Like, did your speech therapist ever try and use music as a tool? Um,
Yeah,
and what did that
yeah.
look like?
Later on, as I was playing guitar and singing Catherine Hayes again, I would bring my guitar there, and
Mhm.
we would work on songs, um, with with clients. I have them sing songs that they enjoy.
Mhm.
Oh, and the other thing was singing in the shower. And this was actually my functional neurologist suggested this: sing in the shower. And he's like, and sing loud, you know? And it wasn't necessarily in the shower, but the shower was like a place that felt like pretty natural place for people to be singing, right? So
Yeah.
singing in the car, singing in the shower, whatever, singing loud. And it's not something that happens too much with speech language pathology traditionally, I guess.
Mhm.
But I think it's a very powerful practice.
Okay, but your speech pathologist did in some ways incorporate music, it sounds like.
Yeah.
Okay.
Yeah, I was like, I wanna incorporate music, and she's like, bring
Yeah.
your guitar. And so we did that.
Okay.
And I mean, she had her own office and her own building and whatnot. Um, so she could have me be loud.
Yeah.
But I think that like if you can or incorporate music, that's awesome. And one of the greatest parts of utilizing music is that it motivated me.
Mhm.
Music was a huge motivator for me. And so you, finding what motivates people is so
Mhm.
huge, right? And really getting to know them. And I was actually talking to my partner today, about how I used to use beatboxing as therapy as well, because I used to, I had friends that would rap, and I would do beat, and and that right there, like doing things like that. I mean, she was like, I don't even know what beatboxing is. And some people don't know what beatboxing is. But if beatboxing is something that motivates somebody, it's like, yeah, do that.
Yeah.
Um, that use your mouth to make noises, to make sounds. And I ended up slow. So I will say that throughout my recovery, people would mistake me for being drunk, as I'd
Yeah.
said
So
earlier.
tell me some more about that, and tell me kind of how that was perceived in the world, and any strange interactions you had, and then also um, what were there any techniques that were used in therapy to try and work on any of that?
Again, how much time do you have? So yeah, no, but honestly, like when it comes to stories, I have some great stories that I could tell, but it's going to take a little bit. Um, one just people thinking that I'm intoxicated, and of course, like slurring
Mhm.
and or really slow speech, because I learned to, instead of slurring, to slow down my rate of speech so that I could enunciate each syllable. And this is what I work with my clients to do, because if you can enunciate well, in martial arts, I was taught slow is smooth and smooth is fast. So we would work on things very slowly. I'd work on doing a side kick like super slow and then bring it back. And then I could be like, bam, snap it out super easy, because all of the neural pathways have been built to the brain and the periphery had really solidified those neural pathways to where it could just do it. And actually they call it central pattern generation. When you generate a pattern in your brain and peripheral system, so it just has to send one signal and your body does the rest.
Mhm.
um and that takes some time. So yeah, so I have slowed down the rate of speech. I still speak slower, I know that.
Mhm.
And I still get mistaken for being intoxicated sometimes.
Okay.
um it's gotten better since I have a service dog, and people are like, oh, there's some going on, but I look pretty recovered. Plus, I walk around wearing a leather jacket and like, I used to be a bartender, and I fit the profile for somebody who's drunk, right? Um, so, so you see somebody in their, mid late 30s stumbling around and slurring their words, you're not like, hmm, he probably had a severe traumatic brain injury and survived against all odds and recovered beyond anybody's expectations. And now the artifact is that he looks a little intoxicated. Yeah, that's the first thing that comes to mind,
Do
right?
you ever, along those lines, do you ever, in certain situations, self-disclose that information to someone? So let's say if you're at a event or something and you get the feeling that someone is maybe perceiving the slurred speech or something, have you ever self-disclosed, or do you wait for someone to ask something?
I used to. I used to make it like like a big point, like, I'm not drunk, this is what's going on. And I know it seems this way. I actually have this, and was really, really forward with it, and like then it just became the topic of conversation.
I see.
And it was just like, I want to talk about other things.
Other
I
thing,
want to
yeah,
I want to live a life that's not just my story
right.
all the time. And then what happened? Then what are you doing? And so I don't say it right off the bat anymore. And I've recovered to a point where I don't need to as
Right,
much.
right.
Um, and 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 honestly, having a service dog, people are like, just are like, something's going on. All right,
Yeah,
cool.
yeah, yeah. It's
Um,
understood, yeah. Mhm.
yeah, but it's interesting, the perception of people. Uh, it really it was so upsetting to me for a long time that people would just think I'm stupid, think I'm drunk, think I'm, you know, high, whatever. They think I was everything but what I was,
Yeah.
and it used to bother me. And somebody somebody once told me, you know, what other people think about me is none of my business, and I love that.
That's pretty great. It's good. It's good. It's a good way to kind of let that roll off your back, you know.
Yeah,
So,
yeah.
okay, so we've talked a bit about the swallowing aspect. We've talked a bit about the ataxia of speech and kind of how that was targeted in therapy and the music. And I really like that takeaway of finding things that motivate people because, you know, as clinicians, we are trained to always put the person first. And so it really should be goals that you're interested in and using things that motivate you in therapy. It sounds like your speech therapist after the hospital definitely did that, found ways to incorporate things that were motivating to you. Let's talk a little bit about, you mentioned earlier in our discussion that you felt like your speech pathologist focused a lot on this cognitive rehabilitation side of things. What were the things that you guys worked on, and what were the things you were noticing were hard for you as you were recovering in terms of cognition?
Hmm. There was a lot of things, and honestly, I have done so much cognitive stuff that it's hard. Like certain things aren't really coming to mind.
Sure,
Um,
sure,
in,
sure.
in I can tell you some things that I use with my clients, which actually, so I use an app that I find very useful.
Mhm.
It's called Elevate, and it's free cognitive exercises. Um, and it's not super easy. It's a bit more advanced.
Mhm.
However, it also sends reports of like how you've done it, how you're doing with it, and my clients just send me screenshots of how they did on each one of them. So, I get to see that they did it for that day, and I get to see their results. You know, um, so but I know I would recognize a lot of different things, and there's another thing about like looking at a screen is harder on our neurology than doing it pen and paper. And I wish I could remember some of the tests and things that were done.
Yeah, did
But
you notice, I'm just curious, because not everyone has the same, obviously, the same kind of set of differences that emerges after a brain injury. Did you notice any changes in your attention or memory?
yeah, yeah.
Yeah.
Um Attention, very easily distracted.
Okay.
Uh and I mean, early after a brain injury, there's a lot of neuroinflammation. There's a lot of, n- n- honestly, neurodegeneration happening. So it's very much a state where the input you're getting is, you're less able to use. At least I was less able to use my frontal lobes to regulate my limbic system, which is, you know, very emotional and very reactive instead of responsive.
Mhm.
So something would happen that would push my buttons, and I would react with snapping back in some way, shape, or form.
I see.
And working on controlling my frontal lobe to actually, you know, integrate with my limbic system. And I have a very unconventional tool for this that I use with my clients that I have found very useful.
Mhm.
And so, neurological, what's the word I'm going? Principle
Mhm.
is Hebb's postulate. which is that neurons that fire together wire together. And so and it's so true. Like when we fire, so the idea with this strategy is my frontal lobe and my limbic system aren't talking very well. You
Mhm.
know, something will come, it'll hit my limbic system, and my frontal lobe won't get the relay before reacting. It'll just go straight to action. And what I wanted to do was go to my frontal lobe, let me go, how should I respond? And then send the action, right? So because neurons that fire together wire together, we need something that stimulates the limbic system and then a way to override that. So we do some things in functional neurology where it's we call them antipsychotics, where basically you see a visual stimulus on this side and you go this way, even though the stimulus is over here. You look at the dot over here. But let's take that a bit further also. And this is when you hit. All right, imagine getting splashed with cold water, right? Your limbic system goes, ah. And so cold showers. I thought, and like, let's just turn on the cold shower. And everything inside of me is like, get out of here. You know, like my limbic system is firing. And all right, take a deep breath instead of turning on, going to hot and getting out. Take a deep breath and know that you're okay. It's just cold water. It's not going to kill you. You're going to be fine. You're safe. And now your frontal lobe is telling your limbic system that it's okay, that it can not do what it's programmed to do. And that practice has been extremely, extremely valuable. Doing that, I used to even do it where I walk straight into a cold shower, which is like high level. You're going high level with that one, but it really helped to get used to something coming that absolutely hits the limbic system, to let it pass, to use your frontal lobes and strengthen that ability. And what happens with clients is a lot of times they can then regulate those aspects as well. And there are other practices. I mean, knowing where you are in space and time is so powerful as well, because when you don't know where you are in space and time, like you can't really be comfortable with you can't really be comfortable, period. Because you don't know where you are. And so helping people's to build those neural connections. And I use things like vibration platforms, because that's sending more information from your peripheral nervous system to your brain, and building those connections. I use things like exercise, simple things like exercising and using your whole body. And actually, something that was really valuable was yoga first, and then moved from yoga to jujitsu, which
Okay.
is resistance with another human, you know. And obviously those are high level
Yeah,
things that were
absolutely.
really,
Right.
yeah, those are like moving forward. But yoga is something that people can do.
Mhm.
And yoga is just such powerful practice.
I agree. I'm going to focus in now, if it's okay, since we're kind of at the
Totally.
hour mark, on a few remaining questions.
Yeah,
Um, if that's okay with you.
absolutely.
Okay, so one of the questions that was asked, and this came up a few times, is whether or not you notice still any symptoms from your brain injury initially, what those are, and if you're receiving any kind of maintenance therapy at this point for those symptoms. Obviously, you're extremely well versed, and it sounds like you've got a lot in your own toolbox that you've put together. And so, it may be the case that that's kind of what you're doing, but just curious to kind of hear about that.
Yeah. So I already showed you
Mhm.
the cerebellum aspect. That's definitely an artifact, and it's that also goes to my leg, and my
Okay.
whole left side is uncoordinated. So I'm working on running, and I like doing my own therapy, understanding how the brain learns, and understanding neurology has been
Yeah.
extremely powerful for me. I mean, I read many peer-reviewed studies and
Mhm.
look through the research and learn a lot. And then I'm going to neurology conferences. I'm speaking in neurology conferences. Um, and so it's all, and I know a lot of people that are doing these practices that are giving me tips and things like that.
Sure.
Um, and so some of the aspects that some other artifacts is that my swallowing mechanism, it's still not great. So I tend to aspirate
Okay.
um, sometimes, you know. I
Mhm.
need to tuck my chin in order to
Okay.
swallow still to this day.
Okay.
And nobody really notices. Well, maybe you did when I was sipping coffee. I bring my like I don't bring my head up and
Sure.
swallow, and that's and even holding my chin straight is hard for me. I've
Sure.
practiced with I practice with water sometimes, but honestly, it's not that big a deal to me. Um, there's more important things for me to work on. um, but yeah, so swallowing is an aspect that's still an artifact, but it's not a big deal.
Mhm.
Um, let's see. Other artifacts, attention and visual, they're definitely visual artifacts. Like I still have double vision,
Okay.
um, which is why I wear glasses. I didn't used to wear glasses. um, Sorry, the
Oh, no
sun's getting right
problem.
in
No
here.
problem.
It looks kind of cool right now.
Yeah.
We'll let it rip.
And then
um,
you said some attention as well, you mentioned.
yeah.
Okay.
Yeah, attention as well. I've been working a lot on honing my focus. I mean, sometimes my focus is like nothing will distract me at all, and sometimes it's like, look, a bird, like it's a girl. Like, it's kind of both. The other thing is awareness of everything around me.
Okay.
And it's hard, especially when I'm walking. Like it's great when I'm sitting down and my cerebellum isn't working really hard. But when I'm walking, for example, I have trouble looking different directions. Like I can't really like scan the area as well
Okay.
as I used to. Um, so that's something I'm working on as well. And I'm doing things like walking on a treadmill and turning my head, where there's handles, so if something like
Right.
I fall a little bit, I can catch myself and
Mhm.
looking up down. I'm also using a vibration platform, and vibration platforms are awesome. uh, I'm going to be interviewing Joel from Life Pro, feedabrain.com/Life Pro. That's where the interview will be.
Okay.
Either that or feedabrain.com/Rumblex. Either one will take you to the same place, because I use a vibration platform called the Rumblex, which is, I mean, they have vibration platforms that are like thousands of dollars, and this is like a couple $100, and it's awesome. So I'll stand on the vibration platform and I'll work on things like closing my eyes, looking left, looking right, looking down, looking up, um, kneeling down, doing some translation with it, and basically challenging my vestibular system while I'm getting a lot of peripheral input, right? Neurons that fire together wire together. So if we're getting that input, and I'm stimulating my vestibular system, it begins to really see where I am in space and time and building those connections. Um, Yeah. And
So,
I'm even doing, go ahead.
oh, so it sounds like mainly the changes with like vision and the ataxia are what's remaining. A little bit of stuff with attention you mentioned. Is that? Do you feel like that's pretty much covered? What's left in terms of recovery for you?
Mm, you might want to ask my partner, but I walk right now. But yeah, yeah, I'm sure I have blind spots. We all do,
We all do, of course. Of
and
course.
I'm sure I have more blind spots than most people. Um, but uh, but yeah, that's all I can think of
Okay.
right now.
Another question that was asked was, they noted that you've made such a spectacular recovery, but other folks, depending on their brain injuries, may have a much slower moving or longer recovery. What advice would you give to traumatic brain injury survivors and their families who seem not to be recovering as quickly? What advice would you give?
Mhm. First of all, I felt the same way, and I totally get that. That feeling is so valid, you know. Um, and I the 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 biggest thing is perseverance. Every day, do something working towards what you want to accomplish, you know, and be clear about what you want to accomplish. So so for me, like looking forward, um, actually for clients, for all sorts of things, looking forward and not looking back. You know, you can measure the progress you've made by looking back.
Hmm.
That's it. But you cannot measure looking forward. It's
That's
like
really good
trying to
advice. Yeah.
it's like trying to figure out like how far is the horizon. All right, let's keep on walking. It's over there somewhere. Trying to catch up with the horizon. You're never gonna make it because you can't see how far you've gone there if you're trying to measure forward. So so look forward, measure backwards.
Mhm. That's really great advice. Thank you. We're wondering if you, at any stage, and this probably sounds like it would be more like Catherine would have been the person to have done this, but if your SLP ever provided any level of counseling surrounding the brain injury or communication, and what advice you could give to us as future clinicians about how to counsel people with TBI. What are the sorts of things that you would have found useful or did find useful?
That's so good because yeah, uh, my speech language pathologist, Catherine Hayes, was more of a yeah, I don't know, psychologist in a lot of ways, you know. There was a lot of things that we would talk about. There was a lot of trust built, um, and it was a lot of emotional, like moving through emotional aspects of
Mm,
of life with the
yeah.
brain injury. Um, and I guess the biggest thing is seeing people,
Mm.
helping people be seen. I was recently talking about this. Dan Pultz, who I met when I had my brain scanned with high definition fiber
Oh,
tracking, which
okay.
I showed you at the
Yes.
beginning.
Hmm.
I met him there, and he works with veterans with brain injury, at the University of Pittsburgh. Yeah, yeah, UPitt, and and he taught me this. He taught me that everybody wants to be valued, understood, accepted, loved, and trusted. Vault,
Oh,
VAULT.
okay.
Valued, accepted, understood, loved, trusted. And that is so true. So if you can help people feel valued, feel accepted, feel understood, or feel like you're trying to understand,
Mhm. Mhm.
um, because being understood takes you know a receiver and a transmitter. Both
Absolutely.
need to work out. But you're trying to understand them, um, loved and trusted, like that that is all so powerful, and that's what being seen is.
Yeah. That's great. That's very helpful. Thank you so much. And then a final kind of question. Was there a particular community resource, whether it be a single person, a provider of some kind, a service, or a place that was the most helpful to you and your family during the recovery process?
Absolutely. Charlene Crump at the Mary Lee Foundation, in Austin. Mary Lee Foundation really just, yeah. Thank you, Charlene, and thank you, Chip Howe, rest in peace, who was the admissions coordinator who brought me in. Um, the Mary Lee Foundation really is provides a lot for
Mhm.
people, um, and like any facility, there's a lot to be improved upon, and there's so much good there. So yeah, huge props to the Mary Lee Foundation. They made a huge difference.
Okay, great. And then if there's anything that you feel like we have not touched on that you'd like to share with the class, I know we talked about a lot of different things today, and thank you so much for sharing so much of your expertise and all of the things that are working for you, like you said, that maybe are not currently part of the kind of medical model and offered at a wide scale. That's really helpful for us to hear about. And of course, the class will go to your blog, and we'll have access to different videos that I know you post incrementally with different invited speakers. But is there anything else that you'd like to just share with us that you think is important that we didn't get a chance to touch on?
Yeah, I appreciate that. I'm definitely going to take this video and I'm going to put it on my blog. So adventuresinbraininjury.com or feedabrain.com. I think I'll do feedabrain.com/SLP. And I'm going to put all sorts of different resources there, that I've found helpful. I want to build up. I absolutely love working with practitioners and especially students, because y'all are the future of medicine, and that's what I'm all about, evolving medicine. This is a passion of mine, and I love working with people who are also share a similar passion, and I think you all do, and that's the reason you're becoming speech language pathologists. There's a lot of care and compassion with that. So yeah, I'll create something at feedbrain.com/SLP and adventuresinbraininjury.com/SLP. Um, and there's going to be lots of, I'll keep bringing resources. I'll put some videos there, and I'd love to keep a conversation going
Yes,
with you guys. So
certainly.
you can also find me on Facebook, Kevin Ballister, or Adventures in Brain Injury page, or the Feed a Brain page. Those are my two companies right now,
Great.
and yeah, and if you and as far as empowered neurorehabilitation, that's what I'm doing a lot with clients, and I'd love to chat with you guys more about that.